So what I have done with this presentation is to create a set of slides and brief presentation to basically answer questions that I get all the time about what the different kinds of therapists are in Denmark. This is intended for people who have moved into Denmark and perhaps the qualifications and or the letters or credentials or whatever for psychologists were slightly different in their country. So first, here are some terms you might hear when looking for a therapist. You might hear the term therapist, and I'm going to clump that together with the term psychotherapist, sometimes also just referred to as a counselor. Another term you're going to hear is psychologist. And finally, you might also hear or run across authorized psychologist. So let's talk about the different kinds of things and qualifications that each of these professions can do. One is the task of therapy or psychotherapy, and that is just when you sit down with a person or a group of people and through talking, you help them to feel better about a particular kind of issue or problem. And the second one is assessment, which includes both testing and diagnostics. And so if somebody gives you an intelligence test or a personality screening or a test for depression or anxiety or stress, that's a test. And diagnostics just means the ability to consider or to actually make psychiatric diagnoses. Also, some of these professions are trained or not trained in research. So they have either research training and research capabilities and or they don't. And some of them have been required as part of their training to submit an original piece of research to the field of their choice. The professions I'm going to present also differ in the amount of experience they have. Some are right out of school and some have had a lot of experience. The schooling itself is different. Training programs are different among the different professions. And finally, the amount of regulation that the state, in this case Denmark, imposes on that profession. You may think this is not a big deal, that the government or some governing body has a say in your profession, but the things it does is that it ensures at least a basic set of criteria are met before somebody can call themselves a certain profession. And also, I think importantly, it gives you a place to complain if somebody does a bad job or if you're harmed in some way. So here is a table that I've created, and you can see if somebody calls themselves a therapist or a psychotherapist, that, see if I can get a pointer here, that they can do therapy. However, they typically cannot do diagnostics and assessment, and very often are not schooled in psychiatric diagnosis. They have not typically been trained to do research, nor have they necessarily contributed to the field with an original piece of research. The experience is very variable. You might get somebody who has a lot of experience. You might get somebody who has no experience. The schooling is variable. There's not a set curriculum for somebody who calls themselves a therapist or psychotherapist. And right now in the state of Denmark, there is no regulation about a therapist or psychotherapist. So if you felt you were getting a bad service, there would be nobody you can complain to. Psychologist is the more regulated profession, and yes, they can also do therapy. They can also do diagnostics and assessment, and they're particularly trained in doing testing if you need that or your child needs that. They are required to do a piece of research at least to get their degree, and they have usually had specific training in that. Now, the thing about just a psychologist or somebody who calls himself a psychologist as opposed to authorized psychologist is that they're not guaranteed to have any kind of training, and they can be just right out of school if they call themselves a psychologist. Typically in Denmark, most psychologists pursue authorization, which means that you have a certain amount of experience. The schooling to become a psychologist is regulated. Even if you're coming from another country, you have to submit your courses and all of your supervision you've had over the years in order to get this label. And it is highly regulated. And finally, the authorized psychologist, they also do therapy, diagnostics and assessment, research, and they need to have a minimum level of experience. This is the main way that a psychologist differs from an authorized psychologist. It's also regulated, schooling, and highly regulated profession, which means, of course, that you can complain if you think something goes wrong. A couple of other notes here. You'll see some psychologists in Denmark, particularly expat psychologists, have a PhD, whereas most have masters. All that's about is that some countries require a doctoral level training or PhD, doctor in philosophy, to practice psychology, and others do not. Denmark does not require a PhD, they just require a master's. And in the States, in some other countries, I think England and I think Australia as well, it's required that you also get a PhD. They have what they call the scientist practitioner model of training, where you're equally trained approximately in being a therapist and also in doing research. Some people ask, where does psychiatry fit into all of this? And it does and it doesn't. Most psychiatrists, they have a medical background, a medical training, and often are not trained to do therapy, though they can get special training to do therapy. But what usually ends up happening in a country like Denmark or the States or other countries that have some sort of, a finite number of krona to spend on healthcare is that they end up mostly just prescribing medication. So in terms of you choosing, I'm trying to give you some information to, quote, let the buyer beware. But you should look at their qualifications. You should look at some things like, do they continue with their training? Do they supervise with other professionals? But also, it's really important that you establish a relationship with somebody who you're very comfortable with. And what I hope is that you at least that you have a chance to. Some therapists will offer a free consultation, so you can at least see, how do I feel sitting in the room with this person? Is this somebody that I will feel safe with? Because your therapist, you end up hopefully opening up a lot to them, and so it's really important that you feel comfortable. At any rate, I hope this has been helpful, and good luck